Hi, Assalamualaikum and a very good day. In this video, I will talk about primary myelofibrosis or PMF, particularly about the clinical features and also the laboratory findings. I am Dr. Wanasmuni and I'm from the Department of Pathology, University Technology, Mara. Primary myelofibrosis is a clonal disorder characterized by progressive generalized reactive fibrosis of the bone marrow in association with the development of hematopoiesis in the spleen and liver, which is also known as myeloid metaplasia. Fibrosis in PMF is due to hyperplasia of abnormal megakaryocytes. For the clinical features of primary myelofibrosis, it is usually an insidious onset in older people, and usually they come with symptoms of anemia. There will be splenomegaly, almost in all cases, and there will be symptoms resulting from massive splenomegaly such as abdominal discomfort, pain or indigestion, just similar to chronic myeloid leukemia. And they may be also presents with hypermetabolic symptoms such as weight loss, anorexia, fever and night sweats. And they may also come with bleeding tendencies, or they may come with bone pain or gout in a minority of patients. And in some cases, they come with transformation to AML at presentation, which occur in 10. This transformation to AML occur in 10 to 20% of patients with PMF. For the laboratory investigation of primary myelofibrosis, in full blood count, the hemoglobin may be reduced, normal or increased, depends on the phase of disease at presentation. And the white blood cells and platelet counts are frequently high at presentation, and later in the disease process, there will be leukopenia and thrombocytopenia. On peripheral blood film, there will be leukoerythroblastic blood film, which is presence of NRBC and also left-shifted cells, which include the myelocytes. And the RBC shows a characteristic teardrop poikilocytes. I will show you this later. And on bone marrow examination, usually the aspiration is unobtainable because of the fibrosis, and the trephine biopsy will show a fibrotic hypercellular marrow with increased megakaryocytes, and in 10% of the cases, there is increase in the bone marrow formation. For the molecular study, JAK2, CALR, and MPL mutation occur in about 55%, 25%, and 10% respectively. And there will be high serum urate and LDH levels, which reflect increase in ineffective hematopoiesis. Okay, the picture on the left-hand side shows the peripheral blood film of patient with PMF. As you can see here, there is NRBC here, which indicated leukoerythroblastic picture, but in this view, you can't see the immature white blood cells. Okay, and the presence of teardrop poikilocytes. Okay, so here is the teardrop poikilocytes, which indicate fibrosis. Okay, so these are the typical findings of patient with PMF, leukoerythroblastic blood film with presence of teardrop poikilocytes. And the picture on the right hand side here showing patient with massive splenomegaly. This is the picture of bone marrow trephine section from patient with early stage of PMF. So the one on the left shows hypercellularity. If you can see here, there are less fat spaces, so this is hypercellularity. Okay, and also disorganized architecture, increase in megakaryocytes. Okay, megakaryocytes are the large cells in the bone marrow. Okay, so all these are megakaryocytes. And also on the right hand side here is the silver stain. So the silver stain function is to highlight the reticulin fibers, which indicate fibrosis. Okay, if you can see here, they are all the reticulin fibers. Okay, this indicate fibrosis. Thank you. That's all for primary myelofibrosis. If you have any question, you can email me at asmuni03@uitm.edu.my.